So good afternoon, everyone. I'm Courtney Healy, Chair of Sláintecare Citizen and Staff Engagement, and I'm delighted to welcome you to today's webinar, the 6th Sláintecare Integration Fund webinar, part of our Learning Network event series. As those of you who've joined us on previous occasions will know, some of the videos we have for you today may move out of sync in places. So apologies in advance for that, but overall we are confident that it won't take away too much from your viewing and listening experience. We are taking questions during the broadcast, so if asking a question or making a comment, please do indicate who the question is for, and we will make sure to get the answers for you. The Q&A button is at the bottom of your screen, and if you type in a question there, it will come straight into me for my attention. We're very happy to be delivering these webinars in conjunction with the Health Service Executive and with the support of IFIC, the International Forum for Integrated Care. Sláintecare is, as you know, about providing right care in the right place and at the right time. And in these webinars, you'll hear how the project funded by Sláintecare integration funds and some HSE funded work is showing us best practice for healthcare reform and showing how many have adapted work practices and created improved pathways while responding to COVID-19. This afternoon, though, our focus is on community engagement and showcasing the role that community, voluntary and charitable organisations play in our social and economic life, but in particular in health promotion and care services. We'll share stories today of projects from the community and voluntary sector, which have a focus on empowering people and communities to be more engaged in their own health and well-being. The innovation and best practice that these projects represent will be of huge value to the work underway in every county to implement the Sláintecare vision. A recent development we wanted to highlight today with our focus on community engagement was the launch last week of an initiative involving local authorities around Ireland called Keep Well. I'm going to share with you now a short video on Keep Well, and then I will be joined there by Michael Walsh, CEO of Waterford County Council, to tell us a little bit more about the Keep Well national and local community initiative being driven by local authorities, supported by Healthy Ireland Sláintecare funds.
Recent times have been unlike any other. So, to help look after our bodies and our minds for the months ahead, it's good to decide on a plan. To keep getting a little exercise outdoors when you can. To keep up a hobby or start a new one. To keep in contact with friends and family. And to talk to someone if you're feeling down or need some support. Decide what's part of your plan today to keep well. Find more ideas at gov.ie/Healthy Ireland.
So, good afternoon, Michael Walsh. I'm so pleased that you've been able to join us, CEO of Waterford Council. Michael, we've just watched the little promo video there for the Keep Well campaign, and I know that this is a partnership and Sláintecare funding has been delivered through Healthy Ireland to allow you and other local authorities to do what exactly, Michael?
To do what I hope, Grania, we're reasonably good at, is the way I describe it, which is to put all our connections out into communities right across the country in every form that we can to help people get through this pandemic. I suppose to give that context, just in Waterford alone, out of 700 community organisations, one form or another. They'd be from large clubs down to the local residents association and everything in between. And what we have is we have connection into those communities, and they're phenomenal potential force if we can get them all acting together and all acting on the one message. And I suppose that's what we're trying to do, and the funding is a significant help to us in terms of making that happen, to be honest.
So it's really a coordination of all of these wonderful groups who do such important work in the community. And the Keep Well in Your Community campaign, this government resilience campaign, talk me through maybe some of the things that you imagine these groups will now do as part of this campaign?
Well, look, there's, I suppose, 3 core teams in terms of the Keeping Well piece, maybe, and another couple of niche teams that sort of fall under those categories. And what we have out there is reflecting that overall campaign. We basically, it is all about, I suppose, physical and mental stimulation through the winter period and engaging with communities. So the primary areas are trying to ensure that people are connected. And I suppose at a basic level, that would be just to ensure that nobody is left out there without knowing that there's support available to them.
Right.
Obviously, there's a lot of people that would have had a lot of supports historically that aren't deliverable in the pandemic. And then there could be other people out there that just for particular reasons within the different restrictions or any other circumstance, that they might be isolated. And the challenge for us is to reach out to people and say, state is here in many respects, and that's what we are. This is the state joining in terms of government becoming joined up as best it can to say to people out there, look, we can do this. And it falls, there's 4 or 5 thematic areas. There's that staying connected piece, which is about isolation, countering isolation in many respects. There is a creative piece here, which is about mental stimulation in many respects, is getting people to be switched on in many respects, and we're going to do that through the creative communities and the arms we have in arts and culture. And then there's a staying active space, which is very simply that. It is physical activity primarily that's focused on, and is we'll be trying to get people to, regardless of weather and our winters and all that go with that, is to get dressed well and get the hell out there and keep up that bit of activity that'll, good for people both physically and mentally. And that, in a sense, is as simple and as complicated as it is. Anyway, it is just to say, for this winter, and particularly in these circumstances, let's all work together to help each other to maintain that physical and mental well-being through the simpler things that we can do that help in doing that.
Yeah, and I was thinking, in terms of Waterford itself, the Waterford Way, which we've all had hours of pleasure on with my family, cycling and walking it. Like, you have so many beautiful amenities also in your part of the world. That idea of just getting local communities to say, right, let's get out, let's walk, let's eat the lovely local food. All of those things are all part of it, aren't they? Promoting the kinds of things that you already have there. It's just making sure nobody's left out of it.
Yeah, and look, those amenities are all over the country. We can find good reason always for not doing things in some respects, but the reality is that people talk about it being dark in the winter, it being everything. There's public lights within a few miles, even if you're in the middle of the country, of everyone. And those people living in towns or cities or otherwise have plenty of public lighting, and otherwise nothing to stop anybody taking an active walk. Equally, there's plenty of daytime hours during the weekends, sometimes met with many people working at home now and otherwise, and a lot of other circumstances like that. There's no reason you can't do this locally for a half an hour, even at lunchtime in many contexts.
Exactly. Yeah.
So,
and as you say, this is all around the country. All of the local authorities and bodies are really getting behind this. What benefits do you think are likely to come out of this nationally and locally? What are the benefits?
Well, I think the benefits are to the population as a whole. And I think in a way what we're trying to do is create a movement of people here recognizing that we're in a difficult place. This pandemic, nobody wanted it, believed it could have happened if you were asked 9 months ago or 10 months ago. And the challenge here is for us to work together to get through this. And I actually think the benefits both at national and local level will be from that collaboration. This is the essence of community, and we're big, broad community on that now. We're a national community, but we're a series of local communities, and this is about us all helping each other ultimately right down to neighbor, encouraging each other, activating each other, and physically helping each other if necessary to ensure that we all get through this okay. And into doing that, I think there'll be a distinct benefit in terms of the joining up of government, showing that that can work and can be replicated again in other circumstances, not necessarily,
Exactly.
and hopefully never again in these circumstances.
Hopefully never again in these circumstances. Michael, thank you so much, and I wish you all the best with Keep Well in the Community. I think it's a wonderful initiative, and I can see how local community benefits, but certainly the national community, I think, will benefit from this activation. Well done, and thanks very much for talking to us this afternoon.
No bother. Thanks very much, Courtney.
So thank you, Michael, and best of luck to you and all the local authorities who are involved right around the country in that initiative. I really look forward to seeing how all the local communities partner up to improve opportunities for health and well-being across Ireland. And I think that message of that no one gets left out is a really important one in the times that we're living in. Before we begin our exploration of the various projects that we have for you this afternoon, I'm delighted to bring in someone who is a familiar face to many viewers. Brendan Courtney is a well-known TV presenter who is also, some of you may not know, a member of the Sláintecare Implementation Advisory Council. I spoke with Brendan earlier in the week, and we talked about some of the community initiatives he has seen during the pandemic and how important they are, in his view, for the successful delivery of Sláintecare. So good afternoon, Mr. Courtney.
Hello, how are you?
We're delighted to have Brendan Courtney with us this afternoon, known, of course, to many of you, TV presenter, fashion designer, author, a man of many skills. I think the programs more recently, I loved your Keys to My Life.
Thank
It made
you.
me cry a couple of times, which is a great thing, great work. And of course, you're really moving and poignant piece that you did about your dad. We need to talk about Dad back in 2017. I think for this afternoon, we'd like to pull people's attention maybe to the work that you did in Ireland on Call, where you really were co-presenting with Katie what was happening in the early days of COVID-19 and some of the really interesting community initiatives, people getting together, getting behind each other and really trying to fight the COVID through community engagement, which is what our webinar is about today. So maybe, Brendan, you know, as a member of the Sláintecare Implementation Advisory Committee, you know, you're not a doctor, you're not a psychologist, you're not any of those things. So you really are there as a member of the community who is committed to and has something to say about, you know, a brand new Sláintecare health service. So would you kick off with us this afternoon? Maybe by talking about, in the light of your overview of COVID-19, what would you identify as maybe particular initiatives that have struck you as great examples of community engagement and empowerment?
Well, I suppose we had so many we were on Tuesday and Thursday for 8 weeks live from the Department of Health on the 7th floor. So we would come in at 5, you know, not touch anyone, go straight up to the 7th floor. It was a remote rehearsal, so we were ready to go in, do it, and then we'd go down and watch the briefing and then come back up. And then what we would try and do is take what the news had done and bring it into the community and make it more accessible. So we had so many projects sent to us that once the show started to air, there was a company that were out with like iPhones and smartphones making these videos in the ICU or going to, you know, the woman in the Aran Islands who was her 80th birthday and the community came and sang at the end of the driveway. Like little, just those things really touched people. So what we started to do was be kind of, here's the news, I suppose, here's what's happening, but here's what's happening on the ground. And I suppose it was just to try and make people see the effort that communities were doing, which was remarkable. I mean, we all know the community effort we saw during the pandemic was something we weren't used to anymore. It's something we hadn't, particularly dubs in the city centre. Like I hadn't seen it. I now know all my neighbours. I hadn't known my neighbours before COVID. So every cloud in some ways. But the initiatives we got sent. So myself and Katie then started getting sent initiatives. So we actually had so many initiatives, we couldn't air them all. So we actually had so many initiatives towards the end, we couldn't even reply to them all. So we had to do these blanket replies. So it was remarkable, the amount. The things that stood out for me were, for me, fitness, because I think the fitness element of community work is so powerful on mental health. Getting out of the house into the air clears the head. And there were great initiatives where fitness instructors were taken to the streets and teaching classes on Zumba classes on the street.
Yeah.
And what was interesting was there was no age barrier. All you had to do was live on the street. So for my work, I loved that. It wasn't going into a dance hall or a gym where you felt you didn't belong or it was busy. It was on the street outside your house where you owned the territory. So there was very much, the community territorial thing was a very interesting aspect for me, that people could be part of something, but while being in their own territory. And I think that was very empowering for people. And then they'd come along and let our cameras film, which was even funnier, right? So they were really uplifting things. So I thought that the community health initiatives, as in, you know, positive action health initiatives, as in, let's just get out moving, they blew my mind. And there was one of them, there was millions of them in the end. It was like, people just got inspired by them. The other initiatives I personally liked were watching a movie on a wall at the end of the street, just coming together. And then one of the initiatives that really stuck with me was a remarkable one, and I tried to plagiarize it for a TV show. And in fact, elements of it made it into Keys to My Life. We had already done it, so I can't be accused of stealing it. Was what they did was they got old photographs of neighbors, and they had to guess who they were in the picture.
Yeah.
So you got a real history of your neighbor. So there was one particular one, her name was Agnes, she was 92, she was amazing. And they projected a picture of her on her wedding day. And it was just, I mean, it was tear-jerking. It was beautiful, but they got the history of people. You got to see this person as a young person and really relate to her and really get into her space. So I think it's much, we're only getting to understand the impact of community work. And as I said, every cloud has a silver lining, and the community work spurred by COVID, which, you know, give credit where credit's due, the community projects were being funded by Sláintecare. When I started on Sláintecare 2 years ago, the initiative was there. Now it seems like everybody really gets it, and that's what really empowers me. There's one I must just mention now as well. A neighbour of my mother's, Joan Byrne, God bless her, and her daughter Debbie Byrne, the same age as me, and her mother's in a nursing home, and they're worried they might not get to spend Christmas with her. So she has started this new initiative in Lucan. And I said, no, go global, call it Christmas Community Spirit. And all the garden stations have partnered with her, and people can go and just drop off gifts for people in nursing care homes, and the guards will deliver them on Christmas week.
Oh,
Isn't
that's
that
lovely.
beautiful, right? It's just a lovely little join the dots. So she's done this care initiative for people who are still outside of the community and we can't connect with. So that's different sort of levels of how to connect with people as well. So I think, I think worth mentioning as well, one of my favorite projects is My Mind, free counseling service for people online.
Yeah, we're showcasing them now today. Yeah.
My mother's a psychotherapist and a counselor, and has never been busier. Her work is so busy now. And I think mental health is going to be a big, it's going to be an avalanche of issues coming to face us all personally, professionally. We're going to have to deal with this issue together, and starting at grassroots levels with and in communities is a great way to start to tackle the problem.
Yeah, for sure. Thanks for that, Brendan. And I guess with Sláintecare's Right Care, Right Place, Right Time, you mentioned mental health. There's a new initiative that we're going to mention in the programme about resilience, this Keep Well, getting the local authorities, and it's all about getting out, your mental health, your physical, watching what you're eating, i.e. putting a lock on the fridge and not eating too much for some of us, but that idea of what can I do to keep myself well, and in keeping myself well, you know, I'm not going to get sick. I'm not going to go into the health, the acute health services, and all of that is really helping to deliver on the Sláintecare promises. But I guess the other thing we're seeing, and you've mentioned it a little, the diversity of the community voluntary sector organisations is really, I think, a huge strength in contributing to the delivery of Sláintecare. So, you know, Multiple Sclerosis Ireland or Alone, or a lot of these organisations are doing very different things to protect and prevent people. I'm particularly mindful of those who are working with older people. MS Ireland are working on this active neuro project, and this is where they are working with older people who may have conditions, and they're able to use their phone or their computer to do their exercises, that idea of just keeping yourself well. So I suppose, for you to maybe summarize for us, in reaching people in their communities, it's really important. Why do you think that's important? And how can we keep up the momentum that we saw in the early days? Do you think, has it gone off a bit, or is it still there? And what can we do as citizens, but also as Sláintecare, to give that a hoosh and keep it going?
So I think, and this is just my sort of anthropological view pulling back on it, is that there was a lot of isolation pre-COVID, and older people in carers, unpaid carers in the home, isolated. I met so many people after my dad's documentary who were my age, had given up jobs in England or wherever to come home and care, and we're isolated. And what this has done is sort of flicked the torch back into the homes of people who are isolated and gone, there's a whole community here to help you now. Yeah. So there's another part to this puzzle as well, which I think is empowering people to get the awareness that there is community support there. That's so important. That actually what you eat, where you walk to, is your responsibility. So community care can actually shed that light on people. We're here to help. That, like, literally metaphorically knocking on the door. So I think in a way, I really believe that Sláintecare bizarrely was ahead of this curve, because it needed to happen anyway. Obviously, we could feel it happen, but was just there at the right time to fund these core initiatives. Because I really believe, just in my public life, when you walk down a street and you meet somebody with an issue and you talk directly to a person, there's nothing can replace that. And if that directly speaking to them is through social media or through a direct message or through technology, it's the same effect. You're creating awareness and you're empowering people. So I think, I think the impetus, I think the second lockdown has been exhausting, not going to lie, but I've seen my mother's generation take it on the chin this time, are less afraid of it because they weren't told now to cocoon, lock away. They haven't been as isolated. They survived the first one. They're braver now. I think people who want to go to work are a bit bored of it all, and I think obviously then there's the industries that have been obliterated by it, and that is just shocking travesty of the whole affair. But older people in particular, I find, are being empowered now. Because there's a community initiatives there. You're not alone anymore. Just we have to reach in and they have to reach out. So I think having that mindset of telling people there's brilliant initiatives. I mean, the other thing that really upsets me and excites me in equal measure is when I read an initiative like My Mind. I'm like, oh, I have to tell everyone that. Yeah. Everyone has to know that. You know that feeling? And I think that's the real issue now. It's our job is to make sure people know about the initiatives, and then we can keep the momentum going. But I think there's a buy-in now from people on the ground where we had to, how do we sell this to people? How do we get people involved? Now they're wide open to it now. So, I think the barriers that we experienced before from Sláintecare, from awareness, those barriers are gone. We just have to keep the work going now.
Brilliant. Brendan, thank you so much for your time and for your ideas as always, and your great work on the Implementation Advisory Council. We really appreciate it. Thanks very much.
Thank you.
Bye-bye.
Enjoy the day.
So thank you to Brendan Courtney. Really pleasure to speak with him, and as I say, his role on the Sláintecare Implementation Advisory Council. I think he's inspirational and a real passionate supporter of community engagement. Over the various learning network meetings that we've had, both the actual ones and more recently the virtual ones, we have met the team who are developing the HSE change guides, supporting those who are delivering change to do it systematically and in a way that is sustainable and successful. We were delighted to hear that the guides are now available online. So here's a short video produced as part of the official launch of the online guides, telling you of recent developments and making the change guides widely available.
I welcome the launch of the Health Services Change Guide e-learning programme by National HR Division. It has particular relevance in the context of rapid change as we deal with the ongoing challenges of COVID-19. Teams across the country are required to deliver services in a new way, and we must enable them to deliver innovative, agile responses at local level. As we restore services, it's important that everyone involved in delivering our services are actively involved in the solutions, ensuring people's needs define the changes we make. The e-learning programme will take you through the elements of the Change Guide, building your capacity, skills and confidence for delivering positive change. As CEO, I strongly encourage you to fully engage in this programme with your colleagues. Together we have a better chance of really making a difference.
I am pleased to let you know the e-learning programme for the Change Guide is now live on HSE Land. The corporate plan and people strategy clearly outline our commitment to help staff to develop the capability and confidence to deliver good change in a constantly changing environment. We need to build on the new ways of working that we adapted over recent months by helping our staff to be resilient and skilled to take up their change leadership roles. I wish to take this opportunity to acknowledge our staff and teams across our health services who have responded to the current challenges, demonstrating commitment to maintain and restore services. I am confident that this e-learning programme will assist you and your team to apply best change management practices as we work together to deliver safer, better healthcare.
Change is a part of all our lives. Working in health and social care means responding to rapid emergent change, and that isn't always easy. The Change Guide and e-learning programme have been created for you and I and all of us working across the organisation to help us to do change well together. This means putting people at the centre of the work we do, co-designing change with patients, service users and colleagues to create the right care delivered at the right time and in the right way. What I really like about the Change Guide is how practical it is. There's step-by-step guidance on all of the things you need to think about for delivering change. And it's accompanied with practical tools and templates that are ready-made for use. This means a lot of the thinking is already done for you as you take your first steps into starting your service improvement initiative. The e-learning programme will help you to become more familiar with these and how to approach change. So I invite you to go to HSE Land and complete the 4 modules as a starting point. You can also follow the Change Guide for regular updates on Twitter and the HSE website. When we involve people and understand their personal experiences, we create meaningful change.
Hi there. I'm delighted to mark today the Health Services Change Guide's launch of its e-learning programme. This is an important step forward in how we're going to facilitate change, much needed change, across our health service. The National Quality Improvement Team is delighted to work closely with the designers and movers behind this Change Guide as we work together to improve our services.
For me, the People and Culture Change platform provides the framework and the signposts for how do we do this well. One of the main concepts that I'm taken by with the PCCP is the idea of co-production. Co-production for me is essential to designing service improvement projects and service delivery projects that are fit for purpose and serve the needs of our patients.
For me, the People and Culture Change platform provided the foundation for a successful project by allowing us to reflect on our project and to consider areas that we may not have considered previously. It allowed us to think about the things we had done well, and I feel that it provided us with great guidance and support along the way. As clinicians on the ground, we need to balance, I suppose, our time between clinical role and service improvement role. And the Change Guide really helped us with that and provide us a time and efficient manner to do that.
So thank you to Anne, Katrina and Elaine and the whole team for those really useful tools to add to your toolkit for successful project and change management. And so on to our projects. Many of the projects this afternoon are focusing on ways to engage communities, and we're profiling projects which are funded through the Sláintecare Integration Fund. Our first project is Active Neuro, an integrated care approach delivering health promoting physical activity programs for people with neurological conditions in the community. MS Ireland is delivering this project. They will show us the many benefits of exercise and physical activity for people with neurological conditions and how they are involved in shifting a focus from rehab for new or worsening symptoms to a health promoting physical activity model for prevention. I caught up with Dr. Susan Coote, physiotherapist at MS Ireland, to hear about the project from her and also to hear from some of those who are engaging in the community with Active Neuro. So good afternoon, Susan Coote. You're very welcome to the webinar this afternoon. Susan, thank you for coming on. We wanted to talk with you about your project, Active Neuro, an integrated care approach to delivering health promoting physical activity programs for people with neurological conditions in the community. There is a lot going on in that project title. Talk a little bit about MS Ireland and what the core idea behind this project is.
Yeah, so essentially we know that exercise and physical activity is a really, really important component of living and managing a chronic neurological condition. There's a huge amount of research evidence that says that exercise is helpful, both in terms of reducing symptom severity and improving quality of life, but also importantly, when we're running group programs, we get the social and peer support. So essentially, it's the aim of the project is to increase availability and access to exercise programs for people with neurological conditions.
And what kind of conditions are we talking about here?
Initially, I suppose the ones that as physiotherapists we would see most often would be multiple sclerosis, stroke and Parkinson's. But in this project, we have opened it up to a range of neurological conditions. We know that there's about 800,000 people with various neurological conditions in Ireland. And those range for things like traumatic and acquired brain injury, hereditary conditions like cerebellar ataxia and other movement disorders, and a whole host of spinal cord injury and other things in between. But for this project, the majority of our patients have had multiple sclerosis, stroke or Parkinson's.
Okay, very good. And tell me, before we go into the detail of the project and what it is you're delivering, I'm very interested in a mapping and gapping exercise that you were involved in. So just talk to me a little bit about your mapping and gapping process.
Yeah. I mean, I think for these people, they fall in an interesting intersection between primary care, between disability services, between health and well-being. And when we wrote the grant, the grant was written with Primary Care Physiotherapy with MS Ireland as a charity. And we knew that there was lots of stakeholders. And actually what was really interesting is as soon as we started exploring it, there was actually 3 times more stakeholders than we thought there would be. So you have everything from the sports partnerships who provide exercise programs. You've got the community gyms in various cities, towns and counties. You've got the charities usually doing small pieces in small ways, working quite independently of each other, and then you've got primary care and the transition from acute care services like early supported discharge teams or community neuro rehabilitation teams. So we had an incredibly positive stakeholder meeting on the 26th of February, and really what we learned from that is first of all that there are far more stakeholders involved in this than we thought. Coordination is even more important than we thought it was. But importantly, all of those stakeholders were really, really interested in working together, sharing resources, sharing knowledge, sharing systems, sharing training, and I think creating a pathway. So let's say the person is discharged from acute care following an MS relapse or a Parkinson's exacerbation or a stroke. They then transition to primary care and community neuro rehab. And currently there's this post-rehabilitation void where it's like, what next? What happens? And I suppose this project was aiming to fill that gap and bring together all of those healthcare organizations with the community and the social organizations in a very integrated care model. And as well to I suppose it's that sense of together we are stronger. So instead of let's say, MS Ireland struggling to find enough people in Newcastle West to run a programme, if we look at a broad neurological diagnosis in terms of programmes, suddenly it becomes feasible and it becomes much more effective and it becomes much more efficient to run.
Great. So that sort of building an interagency approach is core, I think, to the rollout of your programme. And I note that you're working with a number of partners in the Limerick Clare North Tip area. And tell us what you're doing with those partners. So are you training these people to deliver a service, or are they bringing people in through your service? How does it work, Susan?
Yeah, so obviously with COVID, what we set out to do and what we're doing now are quite different. So initially the idea was that we would run it as a test program in Limerick with all of these agencies working together, and then we would develop manualize the interventions, develop the policies and procedures, and then we would train people and roll it out across the other counties. Now, unfortunately, the impact of COVID on our stakeholders has been quite profound. For example, primary care physiotherapy lost 40% of their staff due to redeployment. So suddenly that all became not possible. So our focus initially was very much on getting the interventions up and running. So right now what I'm doing is, having got the systems up and running, got the programs running, I'm now shifting my attention to training. So in the next couple of months, we'll be doing some training with primary care teams about how they can start looking at group online programs, and then also with the community and the charity sector and the fitness professionals and yoga professionals as to how can they work in collaboration and how we can get that going.
Great. So in terms of the numbers you're currently dealing with, how are you getting people onto your program? And I suppose I'm interested particularly, has the way you're doing stuff changed because of COVID? Have you had to go more online?
Yeah, we've had to go completely online. So I mean, effectively, the announcement on the 12th or 13th of March meant that we had to cease all our in-person classes. We had literally had our first classes started that Monday, and it was great. Wow. And we got everybody together, and then we had to cancel everything. So we moved to online, and what was really interesting was, this is a completely new service, and as with any new service, the referrals were slow at the beginning. As soon as we moved it online, the referrals shot up. So the need for it was huge, and we've been really pleasantly surprised by how people have adapted to the online environment. Typically, these would be older people. They would typically have cognitive deficits. But they were really, really enthusiastic to get online. There's been nobody who wanted to get online that we haven't been able to. The platform we use is fairly intuitive, and we were slightly overwhelmed with referrals, which I guess really confirms that this is a service that people want. In terms of how people get into the service, initially it was through our stakeholders. So we let the stakeholders know that the service was there. They referred people in. But actually, the charities have probably been the biggest driver of referrals. So people who maybe take part in Parkinson's classes that had to be cancelled, we got a lot of people through that mechanism. So our referrals are about 20-30% higher than what we expected and what we could manage. So we're actually in the position now that we're having to turn people away, which is not good, because ultimately we want these people to, as you said, stay active, stay healthy, and stay at home and through this pandemic.
Great. Susan, thank you so much for sharing that with us. We're going to hear from some of your users now in a moment. So thank you very much, and have a good afternoon. Keep up the good work. Thanks, Susan.
Thanks, Ronnie.
I love the fact that the exercises are tailored specifically to some of the issues that we have as sufferers or as people with MS, such as balance, foot drop, fatigue, and it's extremely helpful to have this structured environment so we can do it every week, which is why I think online classes on an ongoing basis would be absolutely fantastic.
I find it great to maintain my mobility and to do things that I didn't think I could do in the beginning.
For me, it's been an increase in strength. So of course, before, if I were crouching down to get something out of a press, for example, I'd almost need to climb back up the press because the legs but now I can just stand up, which is fantastic. That's an enormous change for me.
I second Katrina.
Yeah.
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 I found before I started that if I stood for more than 3-4 minutes, the whole legs would lock. But now I can do maybe 10 minutes and get away with it.
Brilliant.
Brilliant. And as well as the physical side of it, there's a mental side of it as well, that you feel good in yourself.
Yeah, lovely, lovely.
Great. So, Susan, you've joined us live. Thank you so much. And it was great to hear from the participants and the benefits that they're having, and, you know, simple things like being able to stand and feeling that they have that confidence from the program that you've put them through. One of the things you said in the piece really struck me. Together we're stronger, you said. And a key part of your project is to bring stakeholders together to combine resources and expertise. Would you talk a little bit about, you know, the progress you've obviously made on this? What have you learned in that, bringing different partners together? What's the secret? What's the key?
Well, I think the first kind of success and the starting point was our stakeholder meeting, where we had over 50 people in a room. Now, it's a long time since we had that many people in a room, but I think it was the first success was getting people together, because actually that was an incredibly positive day. We had some roundtable discussions, and the overwhelming message from that is that all of the stakeholders want to work together. They want to work I suppose the second then success is creating a community that is becoming more specialist. So if you work together, obviously you can share resources, you can share knowledge, you can share learning, so that it becomes a more effective service. In terms of learning, there was a number of organizations that were negatively affected by COVID that we couldn't work with, but we've had some very good successes. So, for example, we've worked with the University of Limerick physiotherapy program to offer clinical placement. So that means that the students that will graduate next year will be proficient in delivering these health promoting physical activity programs, and they'll be ready to deliver telehealth. But also that meant that increased our capacity, so we were able to deliver more programs as a result. I suppose the other piece is training and sharing knowledge, and we were able to do some training with some of the rehabilitation assistants from Acquired Brain Injury Ireland, so that they could then take over delivering the programs to the people that were in their group homes that they were working with. I suppose the third example then is exactly what we wanted to do, which is that bridging the health charity community through Limerick Sports Partnership. So a group of ladies who worked with me in the first instance and built up their confidence and got their strength and fitness to a certain level, we were then able to refer them on to the Sports Partnership, and they're now doing some programs with them and within the community. So it is that sense of, I guess, bringing people together to talk about it first and share knowledge. There's the training piece in terms of sharing knowledge and information and systems. But ultimately, I think it has been a very positive experience with all of our stakeholders to date.
That's great, Susan, and great lessons, and I think transferable lessons to others who are trying to do that interagency, bringing people together. Susan, we'll talk again later at the panel, but for the moment, thank you so much. So our next project that I wanted to showcase this afternoon is a project which Brendan Courtney mentioned earlier in his piece. There is a lot of evidence showing that, in fact, the pandemic has really increased pressures on many of us, and some people are finding it hard to cope with the extra stress, including those stressors coming from loneliness and, of course, the hardship of bereavement for anyone who has lost someone in recent months. Gráinne O'Rourke is Head of Communications with My Mind, and I spoke to her this week about their free online counselling appointment service.
So good afternoon, Gráinne O'Rourke. You are very welcome to our webinar this afternoon. Gráinne, we've invited you on, and thank you very much for taking the time. We wanted to hear about your project, My Mind, which is subtitled Free Online Counselling Sessions to Help with Mental Health Challenges of COVID-19. So I think it's a very apt project, and I hear you've been doing great work. Gráinne, maybe you might start by talking to us free counselling in response to COVID-19. Why has this become such an ask?
Thanks, Gráinne, and good afternoon. So we are a counselling service which was set up in 2006, And since the outset of our business, we have actually been providing face-to-face counselling and online counselling. So we received funding earlier this year from the Sláintecare project in response, as you say, specifically to providing some kind of support to people who were negatively impacted by COVID. And that's quite a lot of people, as we all know. And interestingly enough, what had happened was when the COVID pandemic started back in March, at that time, our percentages were probably 90% face-to-face and 10% online. And as COVID developed and continued, the percentages completely flipped, and we're now doing 90% online and 10% face-to-face. So, and generally we provide something in the order of 34,000 appointments a year. And you ask me about the necessity for online counselling. Well, we'll have seen in so many publications, on the radio, on TV, the very real and devastating impact that COVID-19 is having on people, whether it's through losing jobs, losing loved ones, people who are working on the front line in very stressful situations on an ongoing basis. Therefore, it is really important that mental health supports are available to them and that they are free of charge, particularly in a context where somebody may have lost their job and have reduced income coming into the household.
Very good. And as you say, I think many of us have seen this in our own families and in our own communities. What are the criteria for accessing your services?
So the criteria are there in the first instance because we have found down through the years, Grania, that people engaging on a mental health recovery journey need to be doing that of their own volition. And we have found that when we have certain eligibility, it means that people take the service much more seriously. So anybody who had been in receipt of any of the COVID-19 payments, anybody who was a frontline worker, and that didn't just include people in the medical profession, it includes people in shops, bus drivers, anybody you care to mention who is at the front line and having to deal with this on a daily basis.
And tell me, in terms of, so let's say I've been on the PUP payment for a number of months. How do I contact you, and have you got waiting times at the moment?
Okay, so because it's a self-referral system, we can generally offer an appointment within 72 hours of you contacting us. So
and tell me, this is available up and down the country or just in certain regions?
No, so because it's online, it's available wherever somebody has the necessary equipment. So it's available up and down the country. Because we have 5 physical centres and because we are considered an essential service, for those people who are uncomfortable with the online, which I have to say are very few, there is still the face-to-face if you're in Dublin, Cork or Limerick.
So I know that you have targets set for the number of sessions that you hope to be able to deliver. How is it going? How many people are you seeing at the moment, Courtney?
So at the moment, now I will say the project was slow to get off the ground. So it really only started to kick in earnest in July. So since July, we've had 5,000, just over 5,400 appointments. And that translates into 935 clients. And the age ranges are from 16 all the way up to 65 plus. But I'd have to say the majority of people are in the 25 to 44-year-old bracket. And that probably would be in keeping with a lot of the norms for this kind of thing, because those are people who are maybe finishing college or people who are in the workplace who are probably finding it more of a struggle perhaps than others.
Very good. So sounds to me like you're well on your way to meeting those targets that you had set. Grania, thank you very much. We're going to finish with a testimonial from one of the people that you have been supporting. So best of luck with My Mind, and we'll be back to you again maybe at the end when you've finished your programme of delivery to see all of your great results. Thank you very much, Gráinne.
Hi there. My name is Sylvia, and I wanted to share with you my experience with My Mind. I was quite trepidatious about using their online service because I didn't think it was going to be as good as face-to-face. I thought something would have been lost in the interaction, but actually I really loved it, and I'm really glad that I did it. After finishing college, I had all these plans to get back into the hospitality industry with my new credentials, but the industry has been absolutely devastated because of COVID. So now I had to regroup and rethink what to do next. And I was feeling really stuck, and I really felt like I needed to talk to somebody that can help me think and reason through my situation in a new way. And that's where My Mind came in. I went for 6 sessions and I found it so helpful. And they really helped me to work through my worries and my fears and just kind of reframe my perspective on my situation. And I found the experience really positive, really uplifting, and exactly what I needed at a time when I was feeling really down and lost.
So a great testimonial there. And again, I think welcoming Gráinne back to have a short conversation with us. I think that idea of, you know, a young woman like that, just needing someone to talk through her fears and her concerns, and 6 sessions actually saw her back on track and feeling positive. That is remarkable and a wonderful service. But I know, Gráinne, that apart from the free counselling services funded by Sláintecare, you're also supporting people as a result of their experiences of COVID who might be struggling on a daily basis. Will you tell us a little bit about that?
Thanks indeed, Gráinne. Yes, so because we, as a result of our work, or our therapists' work up and down the country, are very aware of the different issues that people are dealing with on a daily basis. We have recently devised a free webinar series, which actually kicked off today for the first time, and it was dealing with the challenges that are faced by people now. More and more of us are working from home, and trying to maintain that work-life balance in those circumstances can be really challenging, and particularly for those who have young children or who have other commitments in the house. So our next one, Gráinne, is next Thursday morning. That's the 26th of November at 11 a.m. And details of all these are on our website, obviously. But next one's subject is dealing with fear and worry, because obviously COVID-19 has brought up a lot of that for a lot of people. And the webinar is delivered by one of our therapists who has experience of counselling in this area. So I'm sure it will be very good and very useful.
That's great. Thank you very much for sharing that with us. And we'll come back to you again in the panel. I'm sure there will be more questions coming in for you. Thanks for joining us again. So our third project showcase today is called Cree My Sláinte, which addresses the lifestyle drivers of preventable chronic disease, a community-based multidisciplinary lifestyle intervention programme which seeks to improve risk factors for many and is being delivered in the community in an accessible manner. Here is Irene Gibson of Cree My Sláinte to tell us more.
Irene Gibson, you are very welcome to the webinar this afternoon. Irene, you are working with Cree My Sláinte. Tell us a little bit about your project. What's it all about?
Hello, Gráinne, and delighted to join you today for this session. So the Cree My Sláinte programme is really about addressing the lifestyle drivers of preventable chronic diseases, such as cardiovascular disease, which we know is one of the leading causes of death in Ireland. So really what we set out to achieve was to develop a 12-week multidisciplinary community-based lifestyle intervention programme to really try and improve risk factors across the spectrum of chronic diseases. So really looking at integrating care and combining lifestyle modification with medical risk factor management with a really strong emphasis on self-management.
And tell me, what is it exactly that you do? So let's say I'm one of these people. How do I get in touch with you, and what is the program you put me through?
So, Grania, once you're referred to the programme, you will meet with our multidisciplinary team, which includes a nurse specialist who's also a nurse prescriber, dietitian, physiotherapist, and basically those individuals will have a one-on-one consultation with you. Now, the programme has actually moved online, so that consultation will be conducted virtually. So you'll have about 45 minutes with each healthcare professional. Following that, you will be invited to join the programme, which runs over a 12-week period, and you will be given access to a virtual platform. And on this virtual platform, you've access to a whole range of educational materials. So we have pre-recorded a number of sessions with our healthcare professionals. We have developed resources, a really interactive workbook to help you self-manage your condition better. And on a weekly basis, you join us for a virtual exercise class, and then also a virtual workshop where we go through maybe the given topic for that week. So it could be maybe on reading food labels, it might be on managing stress, it could be on how to achieve optimal physical activity levels, and so on. So it's a very comprehensive evidence-based program.
And Irene, how do I get referred onto it? Is it through my GP or? Yeah, okay.
So it's a real combination, and I guess this is where the integration of care is really coming into its own. So our referrals are coming from the cardiac rehabilitation centres in the various different hospitals in the west of Ireland. And of course, since COVID, many of these rehabilitation centres staff were redeployed. They're not functioning at the levels that they were functioning post-COVID. So they had reached out to us and said, can we refer our patients to your programme? Because cardiac patients, about 30% of them will actually end up back in hospital again if they don't engage in prevention programs like this. And of course, then we have people who contact us through our own HeartLink West, which is our public information telephone support service. And then we have GPs who also refer as well.
Okay, so in terms of the numbers that you were hoping to reach, how's that going for you, and what are the kind of benefits and how are you measuring them?
So, Grania, the program really only started for us in August. So due to COVID, we had lots of delays. So delighted to report today that we're well on target. So we have over 70 people joining us on a weekly basis on our virtual exercise program and also for our virtual workshops. And our first program actually completed this week. And we're really seeing a really positive impact on the outcome. So what we were looking at is we were benchmarking this program against, I suppose, recommended guidelines around specific achievements in physical activity levels, smoking cessation, weight reduction, also looking at improvements in blood pressure and cholesterol. And the trends are going in the right direction. And I think that's enhanced by the approach that the program is taking. And I guess I mentioned earlier about the nurse prescriber piece. So since we started the program, for example, our nurse prescriber has issued over 40 prescriptions, which is fantastic. And this has all been done virtually, linking with the GP where she needs to, linking with the cardiologist, who's the overall medical director of the program, and the pharmacy. And what it means is that patients don't have to be going to cardiology outpatients, don't have to be going to their GPs other than when they need follow-up bloods. So it's a real seamless service. And I think it's really showing, I suppose, the benefits of nurse prescriber in these type of settings and also on virtual platforms as well, which is really encouraging to see.
Definitely. And also, I think, the importance, as we're showing in this webinar, about the kind of engagement with groups like yourself in the community, pulling the care not just into the community, but into people's homes. Certainly some of the barriers around having to get into a car, take a lift, pay parking outside hospitals, all of those barriers are actually been taken away entirely. I know you're operating Galway, Mayo, Sligo at the moment. Is it possible, do you think, to see this mainstreamed more widely? And what would it require to be sustained and maybe mainstreamed for your programme?
Absolutely, Grania. I think there's really fantastic opportunities here to mainstream this programme into where perhaps there are existing services, but of course, to allow that to happen, I think obviously there would need to be more funding. We would need to look at the IT infrastructure, education and training of staff to deliver programs in this way, because it is a very steep learning curve. And then also, I think programs like this need to be integrated into our national clinical models of care. And there is a new heart program that's come on stream as well. But I guess what we were really trying to achieve at the outset was we were trying to integrate care and not just focus on people with heart disease or stroke, but look at all the chronic diseases. So I think there's a great opportunity for, you know, rather than us thinking of diseases in silos, that we look at, you know, comprehensive approaches. And I think this is where programs like this have enormous opportunity, because they are scalable by virtue of being delivered virtually. And we also have people joining us actually from Donegal, from Clare and from Cork as well.
Great.
But our primary referrals are from those hospitals that you called out and regions you called out earlier.
Great. Thanks, Irene. I know now we're going to hear some of the testimonials from some of the people that you've been working with. So we look forward to hearing those. And thank you for taking the time, and good luck with the work. It sounds like you're doing great work there. Thanks very much for joining us, Irene.
Thank you, Grania.
I'm Jonathan. I'm 38 years old from Westport in Mayo, and I have been living with heart disease for around about 3 years. I came to be referred to the Mice Launcher from Cree following a heart attack just over 12 months ago. One of the reasons why I found Mice Launcher with Cree really helpful is because following my heart event, I suffered a lack of confidence in life and anxiety, and not really knowing what the future held. But the programs really helped me to gain that confidence, and that anxiety is massively reduced because they give you the tools, they give you the information, they look at all of your risk factors and how to reduce those. And it really has given me that confidence back, which I lost. As a new father, it's not just all about me anymore. It is about a newborn baby, and it's about leading a healthy lifestyle with your heart. And it isn't just about me, it is about family now, and we do want to lead a healthy lifestyle.
That's great, Irene, and what a lovely photograph of that young man with his baby. Susan, one of the things, Irene, one of the things Susan spoke about earlier on was integrated care and trying to get away from treating conditions in silos. What's your experience of, you've had success at progressing this? What are the barriers you've faced in getting integrated care up and running, and how have you maybe overcome them? So barriers and how you've overcome them.
Yeah, I think what's important, Grania, to think about is about having, I suppose, a shared mission in terms of what you're trying to achieve. And I think we were very fortunate in that from the outset, and similar to the other projects, it was about engaging with the key stakeholders and getting the buy-in from the off. And I think everybody believed in the project, and that was really important. I think a lot of the barriers we experienced were very practical barriers, some that related to the pandemic. So for example, from a clinical care perspective, patients struggled with getting access to GPs for simple things like getting their bloods done, which impacted on the program and I guess the care that we could provide. And I think other things then that really need to be thought about is the IT infrastructure, and having seamless IT infrastructure regardless of what setting that you're working in. So whether you're in the hospital, whether you're in the community, or a not-for-profit organization like ourselves. But I think, you know, we have enormous opportunities here, and I think that's what we're learning from this project is the opportunities to link with and learn from other Sláintecare projects as well, but also opportunities to share learning and work together as interdisciplinary teams, not as multidisciplinary team. And I think there's a distinction, and it's an important distinction to make, because I think, you know, a lot of healthcare professionals can bring a lot to the table, but it's how do we harness that? And, you know, with the new integrated care program launched, the framework last week, it'll be really interesting to see how we learn from the projects, and maybe we can look at, you know, merging some of these projects, because as I mentioned in the video, the risk factors are the same. And if we're really striving for an efficient patient-centered service, then we need to stop thinking about these conditions as diseases and start focusing on the person.
Very good. Well said. Thank you. Stay with us and we will come back to you during the panel session. Thank you very much, Irene, for that. So our final presentation before we go to all of the panelists is from Leash Sports Partnership. This is seeking to create more opportunities, particularly for older adults in Leash, to become more physically active under supervision of skilled professionals who are equipped to deliver group physical activity sessions. I spoke to Dr. Diane Cooper, a clinical exercise physiologist and researcher in obesity, insulin resistance, and clinical exercise physiology earlier in the week.
So good afternoon and welcome to Diane Cooper. Diane is here today to speak with us about prime time for older adults. That's a great title, prime time. I get all excited. I think it must be about politics. What's it about, Diane? Tell us.
I think prime time in life, Grania. So it's a physical activity research study, and more specifically, it's a multimodal physical activity research study.
What does that mean?
Yeah, so basically we've recruited 80 participants between the ages of 50 and 80, and they train with us. It's now an online intervention because of COVID, which is fantastic. So it hasn't been disrupted at all. It's been able to continue. And within each session, we actually cover their strength work, their aerobic exercise, flexibility, and balance. So we look at 4 of the main components of fitness that we need for healthy aging, and especially for the older members of the group, so to improve balance, falls prevention, all of these types of things. So basically they train with us twice a week, and they do all of this type of exercise, but underpinning it all as well is there's some health education in there so that we can teach people the role of different types and combinations of training in healthy aging, but very importantly also in the treatment and management of their clinical conditions, because it's probably 90% of our participants have clinical conditions, and that's one of the key outputs. Yeah.
Okay, great. So it's a training program. They do it over, is it 12 weeks?
It's actually over 12 weeks, but yeah, because we need that amount of time to teach them everything that we want to teach them. So we are delivering it and facilitating it, but also the other layer of the program is we're actually trying to work with existing structures in the community. So part of the project that our team put fitness instructors through a train the trainer course, and it's specifically to upskill them in the area of clinical exercise physiology. They can train people and deliver this program safely and effectively, as instead of being unsure of what to do with clinical conditions, of which they get many referrals but just aren't sure what to do. So it's upskilling kind of the current structure in the community, but then obviously completely supported by us as well.
And that's very useful, because I think a lot of older people, when they think of fitness classes, they think of young ones in leotards telling them to do things they'd never be able to do. So the training you're giving to these fitness people is about, this is how you do it with 50 to 80-year-olds. So that's really important.
Absolutely.
And you originally were planning to run them across Leash, but of course with COVID, you've had to go online. How has that transition been for you?
So interesting, fantastic, and also something that we had been thinking about for a long time, because traditionally these interventions are run on site. And in terms of, we'll say, accessibility and expanding the program and scalability and being very efficient with your resources, of course that's much easier online. And so COVID kind of gave us the opportunity to trial this. Now, we also are running this as a research study. So with that in mind, we had to do numerous resubmissions for the ethics committee and so on, but they were really supportive. We submitted all of our procedures, which are now different for monitoring and things like that. But it gave us a really good opportunity to trial all of these things. And if we think about it, this is really the way forward while COVID exists for physical activity interventions for these groups. They're completely safe. They can do it in the comfort of their own home, and they're benefiting, as opposed to, we'll say, cocooning that was happening earlier in the year. This is the exact opposite in terms of physical and mental health. So it's really given us a fantastic opportunity out of what was initially a difficult situation.
And what would you say are, if any, are the challenges to the programme as it's currently run? Broadband is obviously one issue, but apart from that?
But we thought that might be a problem, and it is obviously in some regions, but we haven't come across that in the study yet. We obviously had to spend a lot of time in the beginning upskilling some of our participants to use Zoom, which was interesting, but fantastic. Everyone is well able to do this. But also even simple things like we had to get them on email because their take-home resources are now emailed, their videos and things like that they can do at home. But that gives great opportunity as well, because we can send them so many things that they can do at home that they've been learning about in class. So they kind of have it whatever day of the week that they want. But yeah, the monitoring side of stuff as well is interesting. So normally as a clinical physiologist, we would monitor on site and you adapt exercises just by watching people and so on. But this way we actually have to teach people how to self-monitor. So because it's a research study, we brought them in for their pre-testing, which we were allowed to do at the time in small groups. And as part of the pre-testing, we taught them how to monitor intensity. We gave them color-coded cards to show how a certain intensity reflects how they feel. And a number of times during the sessions, we asked them to hold up their cards, and they let us know in that way how they feel. So monitoring has all changed, but it has actually put the focus back on the participants. So they're learning more and more and more about how they feel, how to self-monitor and so on. So there's actually a benefit to it, although it had to be kind of thought out carefully at the start, obviously, given the populations we work with.
Great. And tell me finally, in terms of scalability, what would you need for this to be available up and down the country for all of the people in that age group who might need it and want it?
Yeah, so if it's an online program, that makes things a lot easier in terms of scalability. So it would be about linking with the appropriate partner in different counties. But so the trainer program is already there, so it would be just to put more people through the trainer program, and obviously initially manage it, I'd say, from the core team now, and also have them assess it in terms of effectiveness, as we have been doing. But very, very easy to scale, more so now because it's online versus on site.
Exactly. So Diane, obviously this is a partnership approach you're taking to delivery. Who are the partners involved in the delivery of Prime Time for Older Adults?
Yeah, so we were delighted. We're partnering with Leash Sports Partnership. So they actually secured the funding and they commissioned us, so True Fitness, to actually design and deliver the intervention. So we worked together for a number of years. We're delighted to be partners on this project.
Great stuff. Well done. Well, look, Dan, that's absolutely super. We're going to hear some testimonials now, and the proof, as they say, is in the pudding. So it sounds like you're doing great work there. And good luck with the research project. And we look forward to seeing the final results of that when you've completed it. Many thanks for joining us this afternoon.
Thanks, Grania.
Hi, Diane. I just want to contact you to thank all of the team there, True Fitness and Sláintecare, etc., and that I'm really benefiting from this program. And to let you know that I got my bloods done last week, and my doctor contacted me to say that my cholesterol levels had come way down. And this is great news. Actually, I didn't realize my cholesterol was very high, but anyhow, it has come way down. And this is, she said, this is because of my change of routine. I'm no longer sedentary and following your program. So long may it last. And there's other benefits I feel as well. I'm way more energetic and getting a lot more work done. Okay, thank you very much. Bye-bye.
That's great testimonial there. Great feedback from Anne, Gary, and I think Diane is going to join us now. There you are, Diane. That's great compliment to you from Anne. I'm wondering, what other feedback are you getting from participants, and are they kind of missing the social interaction of coming together physically that they would usually have on a program like this?
Hi, Grania. Yeah, so the best part of my week is actually listening to all of the phone calls and the feedback that we get from the participants. One of the big things is they love that it's online because it's not disrupted by any of the restrictions that are in place. So it's actually a constant for them during these very strange times. But obviously, like they say to us, oh, my balance is so much better, my strength is so much better, my fitness, I feel great, and all of these things, which is great because that's what we're training. But it's how it translates into their daily lives. So for example, being able to get up and down off the floor, going up and down stairs. Even just this morning, someone said to me, it's the first time that they were able to actually lift one leg, put it into the leg of the trousers to get dressed without needing to balance off a wall or a chair. And you can imagine in terms of falls prevention and everything else. So it affects everybody differently depending on their age, but all really, really positive. And I suppose finally, just one of the things, like we do a 15-minute, that's it, of a health workshop every week to teach them about training and types and combinations for different conditions and so on. And they love learning what they can do to manage their own health. And they absolutely love it. So all around, it's definitely one of the best parts of my job is to listen to the feedback.
Excellent. Well said. Thank you. Stay with us, Diane. I'm going to invite the other panelists to join us now and to switch on their cameras. Susan Coote to come back with us, Gráinne O'Rourke, Irene Gibson, and yourself, Dan, from whom we've just heard. So we have had some questions that have come in for people. So I think we've got about 10 minutes in terms of putting these to you and asking you to briefly answer them. Susan, a question has come in to you from Liz. And she's just wondering, what platform are you using for your online courses?
We're using Zoom, and it's the Zoom for healthcare subscriptions. So obviously data security was part of the course considerations, but our main consideration was usability. So as I mentioned, a lot of people with neurological conditions have cognitive deficits. So we wanted something that had the least amount of clicks for the participant, and it's working very, very well. And people are getting on and managing very well.
Very good. And a fellow physio has asked, did you find, like we did, that age is not a barrier to delivery online?
Yeah, and I think Diane will probably find this too, but we were very pleasantly surprised that actually the average age of our participants is over 70. So we thought that when we moved online, we would have all of the younger people who were tech savvy, but actually no, it doesn't matter. And what I would say is do not underestimate anybody these days, because people are amazingly resilient and adaptable and can learn all kinds of new things. So yeah.
And I see Irene and Dan nodding their head frantically in agreement with that. A question for Irene from Catherine. Irene, what are the outcome measures, like weight loss, physical wellness? What outcomes do the clients want most from the programme?
That's an interesting one, Gráinne. And I guess from a client's perspective, for them, it's really about quality of life. And it's about minimizing their concerns and fears about having a recurrent event again. So when we look at outcomes, we look at outcomes across the spectrum. So we look at lifestyle outcomes in terms of achieving weight reduction, adherence to what we call the Mediterranean diet. We look at improvements in physical activity levels, and also medical risk factor reductions across blood pressure, cholesterol, diabetes control. And then from a psychosocial health perspective, we're looking at anxiety and depression levels, how they rate their health. And of course, the My Sláinte program has a really strong evidence base. It's based on the European Society of Cardiology Euro-Action study. So that has been really helpful. So we benchmark our outcomes against best practice guidelines, I guess, really, and also looking at, what are the important outcomes that people themselves want to achieve and goals set accordingly.
And again, Clean is asking, which platform do you use? Are you a Zoom aficionado as well?
Well, we're in the Zoom club as well. But in addition to that, for the online platform, what we have done is we use an education and training platform called Moodle, and adapted it to, to a patient audience. It's normally used for, more professionals. So we've adapted it and tried to make it as user-friendly as possible.
Excellent. And going back to Gráinne there for a moment, Gráinne, just people wondering about the kind of uptake. It seems that a lot of people who are running these projects are having no problem translating them into the community, but are the community responding? I mean, are people taking up your offerings?
Absolutely, Gráinne. And as I said in the video earlier on, it was a little bit slow to kick off, but once it did, and once we got the word out there, and with the Sláintecare funding, we were able to do quite a bit of activity around press advertising, social media, and once the word got out there, definitely we're quite overwhelmed at the moment, actually. And by the end of the year, we hope to have handled at least 8,000 appointments. So that shows that there is a definite need for this service, because we are an early referral service. We deal with people who have mild to moderate symptoms, and yet we can see that there is an increase in the amount of people who have that need for counselling in that area.
And I was taken by your description in terms of when we were talking about accessibility earlier, and you were saying, anyone who is maybe on a PUP payment or a frontline, a bus driver. I know, talking to people who are working in retail, they're getting an awful life from people who are just very stressed themselves. So the fact that they have access to this free counselling service it seems to me to be like a really timely and apt. And if they're the kind of numbers and uptake, community are engaging and they are taking on. So well done with that. Back to Diane then, maybe finally, your feedback there from Anne. And as you say, you're so happy to listen to the feedback weekly from the people who are finding your services are so useful. I guess our theme this afternoon was on community engagement, and you've been getting that in spades. Dan, what if there was one message or one lesson that you've learned from delivering and developing the service that you have for supporting community engagement, what would that be?
Yeah, so we're working across quite a wide age range at the moment, and in terms of engagement, like it's so valuable across all age ranges, but particularly with the older adults, like they really appreciate the weekly engagement, we'll say, that we give from the team, and just the conversations that we have, as well as the training and everything else. But they say to me, we know you're there. We know you're there. We can call you. If they don't want to email, they can phone call. It doesn't matter, whatever medium is appropriate for them. But the engagement piece is really, really important. We were really hoping that we wouldn't lose it via an online intervention. It is different on site, but it's very, very doable, and it's really making a difference in the current climate. And I would say it's just so important. It can definitely be part of all programs, and just stick with it. It's working very, very well.
Well said. Thank you very much. So I'm afraid we've come to the end of our webinar again this afternoon. Time just goes so quickly. But can I say thank you to each of our guests today, to Michael Walsh, who joined us, CEO of Waterford County Council, Brendan Courtney, who joined us from the Sláintecare Implementation Advisory Council, Dr. Susan Coote, Gráinne O'Rourke, Irene Gibson, and Dr. Diane Cooper. This is our last webinar in the current series, but we do hope to be back to you in 2021 to bring more of the superb, innovative work being done to deliver Sláintecare and improve the healthcare service and patient outcomes. Meanwhile, thank you to all the team here who helped produce this session: Rosaline Harlan, Muriel Farrell, Lindsay Dre, Ingrid Doyle, Erica Kinsella, Suzanne Lynch, Andrew Hannigan, and Tom Jukes. You can watch this webinar back or recommend it to your colleagues. It will be available on the Sláintecare website. And do send us your feedback. We'd be delighted to hear it. From me, Gráinne Healy, stay safe, wash your hands and hold firm as Sláintecare continues to deliver on our promise of a health and care system that ensures that we all have the right care in the right place at the right time. So to close out the webinar this afternoon, we're really delighted to have Laura McGahey, Executive Director of Sláintecare, to say a few words.
Thank you, Gráinne, and thank you to everybody who took part today. It was absolutely fascinating to hear all the wonderful stories, all the ways that people are focusing on the people they care about and giving the services to them, albeit in a completely different way, I'm sure, than they envisaged at the very beginning of this year. And it just shows that online really does work, and who would have thought so this time last year. Just in closing, and in, I suppose, looking to what has happened to this year and what we've learned today, the one big takeaway I've heard today is that communities working together can make magic. And I think, as Susan Coote put it today, together we are stronger. So I would like to just wish everybody a very healthy and happy remainder of this year, and look forward to seeing you again in 2021. Thank you all for your ongoing support and cooperation.